I see so many places where the medical profession has got derailed. Where do you think the problem lies, and can we come back from it?
Yeah, I mean, I think one of the major things that's happening to the medical profession is that we get paid per encounter, and you get incentivized to see more people in shorter periods of time. And so that's like, we're essentially asking doctors, hey, do you want your bonus this year? Because if you want your bonus this year, you need to see this many people. And if you don't, if you want to take your time and go slower, that's fine. You could be a better doctor, but we're going to pay you less. And so I simply think how we pay doctors is a big problem. And there's also, I mean, these medical clinics, some of them are partnerships, but more and more of them these days are owned by private equity groups who essentially they buy medical practices and they have a system to make them as profitable as possible. They'll bring in nurse practitioners, PAs, people who will kind of get with the system. And it really is simply, the game is see as many people as possible. And that's just not, that doesn't help people. And so that's the main thing. I think, it comes down to money. The doctors, they have bills to pay. And so it's a financial incentive to just really see people in these quick visits.
Are you concerned about the future or the quality of healthcare in the United States because of what you've seen in your studies and your work?
Yeah, absolutely. I mean, I wouldn't go to any doctor for anything that had to do with chronic disease management, whether it was diabetes, high blood pressure, weight, things like that. I've completely lost confidence in them. I mean, if I needed to get a hip replaced or a knee replaced, or I was in a car crash, sure, I think that stuff is great. Any of these medical interventions where it's like, it's very clear what the problem is and what the solution is, I think that stuff is world-class in the US. But we've completely, I mean, we make problems worse now. I mean, like weight gain, obesity, all of this stuff. I mean, this whole Ozempic thing, I think is going to end up blowing up and being an absolute train wreck. We'll just get stuck in it and they can't come off without gaining the weight back, and they'll have all these issues. Anytime I think we try and fix problems by just drugging them rather than getting to the root cause, I think we're going to just make people worse.
So what's your advice for people? So we have your clinic is the solution to people who have been over-medicated with psychiatric drugs, and you help them taper off. Is there also like do you also provide services to help them move through the problems that initially took them to the doctor initially? And then also for individuals who don't have psychiatric or don't consider themselves to have psychiatric problems, like myself, at least not right now, how do we move through healthcare the way that it is? How do we keep ourselves healthy? So those are two questions. Sorry.
Yeah. So to start with the mental health stuff, that's really hard because I mean, I could say, hey, you're unhappy because you're socially isolated. But then it's like, why? Well, how do you relate to people? What are your social skills like? How do you interpret the behaviors of other people? I mean, some of that stuff can take years in therapy to figure out, you don't like your job and you can't change it because there's poverty. And some of this is going to be really bleak because sometimes there's just simply not an easy solution for the things that make people upset. Now, that doesn't mean we should drug them because that's going to make things worse in the long run. But I think saying it out loud is good for mental health, that, a lot of people are having problems that no one can really help you with because they're really complicated problems. Some things are not so complicated. Time-limited stresses, death of a loved one, obviously that's really hard. Losing a job, you support people, you rally their supports around them and it goes away. But if someone really has fundamentally, difficult things in life, like no education, poverty, things like that, that's really challenging. And I can't help with that. I can guide people in the right direction, but these are huge problems for for people to sort out, and telling them it's a chemical imbalance isn't going to help them. They need the truth, and then they need to be pointed in the right direction to begin the long and slow work that's needed to overcome those issues. For more like health related things, I think some of this stuff is as simple as watch what you eat and get regular exercise. But even that it's so related to mental health. Why are you overeating? Oftentimes it's a way of dealing with stresses in your life that need to be addressed. Why is it difficult to exercise? Well, there's a lot of those things. I think functional medicine doctors generally tend to really focus on getting people off meds and trying to motivate them essentially to do a diet and exercise. I think that's what I see a lot of functional medicine doctors doing. So if you would like that accountability and someone to guide you on that path, I think functional medicine can be good. But you can do that with any doctor really who is more invested in motivating you to overcome those things. But I don't think you're going to get it with any sort of insurance-based plan. You have to pay privately for that.